All right. I am hoping that I can be heard. I'm going to look online here. See if you can see me. So I should be. I love that that camera's working. Gonna add some window capture. Let's make this a little smaller, sorry. Probably don't need to see a lot of that anyway. Cool. All right, so I want to make sure that I can actually be heard this time because it seems like I have problems with that. I go there. Doesn't look like it's playing on. Let's get rid of Twitch. Let's see here. Should be playing. Why is it not showing up on this? All right. Well, I'm thinking that I can be heard. I'm going to guess that I am. But to make it a little bit better here, clock widget, chat. Let's call that. Sweet. Over here. Hello? Okay, good. Looks like I've got sound on here. Okay. But we don't have a chat, so I don't think that I am online like I should be. But it says that I'm live. If I go back here. Go back home. Yeah, that does not look like anything is playing. Oh, yeah, there it is. Ah. Okay. I love it. All right, this is getting me excited. But it says that I'm live. All right. If I go back here, I can see myself. Okay. That's all I needed on that. So I'm going to get out of that so it doesn't kill my bandwidth. Okay, I hope you can all hear me. All right, so I was at work today, had some time, opportunity to take a look at some things that I could do better, how I present myself, and so all good. You know, we're always here to learn, to grow, and develop. And I guess you really can't learn and develop unless you get told if you're unclear on some things. So that's kind of where I'm at, and it's hard to take any kind of critique or criticism, but you just kind of have to figure that out. You really do. So, all good. Okay. Why is it so slow? Why is it so slow? Okay, well, this is also going to be a time for me to try to see why it's lagging so much. And if anybody ends up being in the comments, maybe you can let me know of what I need to do to make that a little bit better. Because that really kind of sounds annoying. And maybe it's just how slow my computer is. Anyway, I was talking to one of my pharmacist friends at the hospital, and I asked the pharmacy so many questions about drugs and interactions and all sorts of stuff. And she had sent me the gold, what is this thing called? The gold guide of COPD. And I know I'm not really supposed to distribute or anything but I just thought this was, I just kind of want to talk about COPD and maybe learn a little bit more about it. But, causes of some chronic illnesses and what you're supposed to kind of do. Consider diagnosis of COPD and perform spirometry if any of these clinical indicators are present. So we got dyspnea, recurrent wheeze, chronic cough, recurrent lower respiratory tract infections, and then history of risk factors. So, of course, smoking, any kind of occupational things that come with dust, vapors, fumes, gases, and then any genetic factors as well, developmental abnormalities, low birth weight, prematurity. So there's quite a few there. I thought this was interesting that inside the lung, these are the kind of causes of some of these chronic coughs. You had asthma, lung cancer, tuberculosis, bronchiectasis, left heart failure, interstitial lung disease, cystic fibrosis, idiopathic cough, and then the extrathoracic, so chronic allergic rhinitis. I'm so having fun with these names. Postnasal drip syndrome, upper airway cough syndrome, gastroesophageal reflux. And then some medications can definitely cause some lung damage and everything like that. So many people suffer from COPD, and it's a lot of the time poor life choices. Just like it kind of said earlier, though, there's a lot of genetic and environmental impacts. Some of it, if you're working a job and you don't have the right respirator or protection for your lungs, good luck. It really just not going to probably go well for you. I've seen a lot of farmers come in with some COPD stuff, interstitial lung disease. But the one thing I kind of wanted to bring up, and there's, I thought this was amazing, where gold 1, 2, 3, and 4 depends on how severe your FEV1 to FVC ratio is. And so that's why pulmonary function tests are such a good indicator for these kind of lung diseases and kind of going on those. So good standard there. I wanted to, maybe that's what I was really kind of wanting to talk about there. There's also a list of drugs, okay, that kind of help out, which was the whole reason that I kind of was looking into this. And again, I kind of almost want to do a little, I should just start doing just kind of some teaching things and try to just do like 10-minute clips. And I should be a lot more organized and all that kind of stuff. So that may be where I go with this, and just hope that I can get enough information out there to just kind of help people and give them a good direction on if they have these kind of diseases, and just kind of going for, all right, this is what I was looking for. And then, also to help educate any kind of healthcare workers. I think we can all use education and learning a lot of the different ins and outs of the drugs, the disease processes, diseases, and just all that kind of stuff, and help all of us become experts. I mean, sometimes you have to be doing those kind of things to actually become an expert. But depending on how severe your exacerbations are for your COPD, I've never really considered doing both LABA and LAMA, so long-acting bronchodilators, and muscarinics. So there is another, So if they're just dyspnea, there's doing these different kinds of drugs versus exacerbations. You want to be a lot more intense, kind of load them up, if you will, on those kind of drugs and really get those lungs kind of fixed up the way that they need to. It seems like we're kind of moving away from some of the corticosteroids. I mean, we still use those, but it looks like we're doing a lot more of these LABA and LAMA type drugs. And so, yeah. But there's a lot of really good information in here, so go ahead and get rid of that. I don't need that anymore. Let's get me a little bit bigger, because you always want to see my face. Let's see if we can find like a watch. Wish they had a timer instead, so that I kind of knew how much. What's this one? No, I don't want that. Anyway, Yep, I'm gonna delete stuff. There we go. Okay. Well, I think, man, this is really hard to try to do all the background stuff and then trying to talk and do all that. So I need to be a lot better about actually being prepared. Yeah, I don't know how to do any of those things, but I don't know. Just kind of looking more on this. Like I say, it's kind of copyrighted, so I probably better be careful what I'm putting on there. Yeah, it's just amazing how much little things you need to do to be able to help people and like into bigger things. When you're talking about ventilatory support with people that have severe COPD, really your non-invasive type stuff, so we're talking BiPAP, CPAP, high flow, nasal cannula, that's going to be a really good method to help out these people. Of course, if they need to be intubated and going that route, then that is where you should be going. But we're trying to stave off those type of things, because these types of individuals, these patients, have a harder time coming off of the invasive stuff. So you have to really work hard getting them off. And it just, not that they can't come off, but it is a lot more difficult, and there's just a lot more things that kind of come up for that. So really, I think getting on their treatment regimen and trying to help them out that way. And exacerbations, if they're mild, you can use some short-acting bronchodilators, If they're moderate, you still want to treat with some of those, and maybe oral corticosteroids, probably antibiotics to help out. And as you can see, it just keeps getting more and more significant. And if they're severe, usually they require hospitalization, They also may be associated with acute respiratory failure. That's always, it feels like, seen. Always, always, always. And you just need to be willing to help them out and kind of get them going. But all right, so now I'm just going to kind of play around a little bit with this and see what kind of things I can do. And I saw like a browser. Maybe that's not the right one that I'm wanting. Stream anywhere. Oh, okay, I don't want to do that. Let's get rid of that. Text template, that's what I want. So you just have simple text. Yeah, I love it. Just kind of keep doing little things. I'll get better at it, I promise. I know this is probably, people are going to wonder what the heck. But, you know, you just keep on doing what you're doing. And then once we take the internet by storm, just kidding. Hopefully I'll have a little bit better idea on how to help and get things figured out. So I feel like I've taken way too